Hi, my name is Melissa and I'm a student nurse. I'll be doing a demonstration on giving Penicillin G Sodium by IV piggyback. So I'm going to start by washing my hands, and before this video I checked my MAR to my doctor's order and to ensure that it was correct, and it was. So I'm going to pull my medication from Pyxis. So we have it here, Penicillin G Sodium. I'm going to take a look at my MAR. So it's Emma Wrightson, which is my patient that I was assigned, Penicillin G Sodium, and the dose is 2 million units, and we have 5 million units in here, so we have enough. Can be given IV, and we're going to try the parental drug monograph to ensure that it can be given IV mini bag as well, and it's given every 4 hours, and it hasn't been given the last 4 hours, so we have the correct time. So now, checking the parental drug monograph. Penicillin G Sodium is an antibiotic, and this medication is for my patient Emma, who has a lung infection right now. A student nurse can give the medication. The usual dose is 1 to 4 million units IV every 4 to 6 hours. So we're within the normal dose. And the max single dose, 5 million units. Again, we're within the normal range. And maximum is 30 million a day, and so she has not received that yet. Okay, and it can be given IV intermittent, which is what we will be doing. It says you can give it in 25 to 100 milliliters of normal saline or D5W, and so we're going to be giving it in normal saline bag, 100 mils, because our patient is in need of more water, just to make sure she doesn't get dehydrated while she has this lung infection, and we're going to be giving over 60 minutes as well, just so that we can monitor the patient and ensure that she's feeling fine throughout the medication. And to check here the compatibility, and it's compatible with normal saline, D5W, dextrose saline combinations, which is what our patient has. They're normal saline D5W, and so it's compatible. And just noting the potential hazards, and we will inform our patient about some side effects that they may experience. So we can go ahead and start the medication. I'm going to wash my hands again.
So this is all good. We're just going to let that hang since it has its lid.
We have our vial here, and we're going to check to ensure that it is not expired.
I'm choosing the second port because it is
okay, and it's not.
Which is what we want, because we want the semen to regulate the rate, and this way the patient can continue.
We're going to clean the top
given at the first port. So wait, so after 30 seconds.
For 30 seconds and let it dry for 15 minutes. And our parental drug monograph says to reconstitute it with 8.2 milliliters of normal saline. So that's what we're going to use here. So 30 seconds to 15 seconds to dry. So I'm not using the full 30 seconds and 15 seconds to dry because for the purpose of this video, but we would do that. I'm going to prepare my syringe here.
We can double check that it is at the right.
So winging it back to ensure sterile technique.
Because it is at about the 13-minute mark, which is what the manual said.
Okay, so we're gonna pull up 10 mil or 8.2. Just to double check it here, 8.2 milliliters of normal saline.
Primary is still running because we want that to continue to be going through, and so we check that, and that is pushing the medication.
And as well, just checking. I would do this beforehand, checking, ensuring that it's not expired as well. And it's
if you feel any of the side effects. I will be back in about 10-15 minutes just to check on the infusion and also to bring a flush in order to push the rest of the medication through the SIVA. If you have any questions, anything I can do to help, use your call bell. I would perform an exit safety check, and then I will return to, or I would document on my MAR that I have given this medication. Thank you. Perfect. Did I check with the primary again when I walked into the room?
Yeah, I think you checked.
using the scoop method. I just have a couple bubbles that weren't coming out, so I'm just going to ensure that I have the right dose here. Okay, so So I have 8.2 milliliters of normal saline. Now I'm going to add this to my drug to reconstitute it. Then pull up the air.
Oh, no, I didn't.
And again, using the
It's good
sweep
that
method.
the band's right next to you, you can like look at it, it's like, oh yeah.
And I'm going to gently roll this to mix it up and ensure that there's no air bubbles mixed in. Checking to see if there's any particles left at the bottom, and there isn't. Now I will prepare my syringe to pull up my medication. So pulling it back, making sure it's sterile technique. Then I'm going to clean my top again, just in case I touched it while I was rolling it. So 30 seconds and 15 seconds to dry. But again, that's sped up. So for the amount of fluid in here, there's 5 million units, and it's a total volume of 10 milliliters. And we need 4 milliliters for our dose of 2 million units. So we'll be pulling up 4 milliliters. So we're going to inject 4 milliliters of air. Okay, so this is our 4 milliliters of our dose that we're now going to do our check here. I misplaced my label here. Okay, so I have, this is my second check. So I have Emma writes in, Penicillin G Sodium, Penicillin G Sodium. We need 2 million units, 2 million units, and that would be 4 milliliters in here, and that is correct. And IV, will be given IV, and every 4 hours, which is correct. So just going to double check my rate, administer over 30 to 60 minutes. Okay, now I'm going to add it to my mini bag. So to clean my injection port here. So 30 seconds and 15 seconds to dry. I'll inject my medication in here, ensuring not to puncture the bag. Okay, so I'm also going to mix it up and just checking as well that the bag is not expired and that it's intact. And then adding my label to this here, to the bag. So now going to my patient's room, I'm going to bring my tubing, ensuring that all my caps are on it, my drug, and my mark here. So as I enter the room, I just do a safety check, ensuring that my patient's not in any distress and that there's nothing on the floor that would be dangerous to myself or the patient. Hi Emma, my name is Melissa and I'm a student nurse. I'll be giving you medication today.
Okay.
And as well, I'm going to check the IV pump. So it's on 30 milliliters per hour, which is correct of what the doctor has ordered. And it is D5W normal saline, and it's not expired. And I'm just going to check the line, the tubing, ensure that there's no occlusions, that the patient's not laying on it or anything. Is it okay if I take a look at your your IV site?
Sure.
Okay, does it hurt at all when I press on it?
No, it's fine.
Okay, and can you tell me your name and your how old you are?
I'm a Watson, and 35 or 30 years old.
Okay, Thank you. And I'm going to check my MAR against your ID. So it's Emma Wrightson. PIN number 123-123-456-456-789. Okay, and so I'll be giving you medication. This is Penicillin G, and it's for the lung infection that you've been experiencing. So some of the side effects that you might experience would be itchiness, shortness of breath, or you may experience diarrhea. So let us know if you have any of those symptoms.
Okay.
And do you have any questions for me?
No.
Okay, thank you. And I'll just check my MAR again with my drug to ensure that doing my third check. So Emma Wrightson, we checked her ID band. Penicillin G Sodium, 2 million units, and IV, and every 4 hours. And I'm just gonna, I forgot to ask her whether she had any allergies. It says that she doesn't, but just to ensure. Emma, do you have any allergies?
No.
No? Okay, I'm just gonna double check on your band here as well. Okay, thank you. So I'm gonna go ahead with preparing my line here. I'm gonna label my line to ensure that the next nurse knows who put it up and at what time and the date. I'm just going to leave this up here for now because when I prime my line, there's just a bit less volume in there, so it may be difficult to back prime. So I'm going to ensure sterile technique while spiking my bag. Okay, and my clamp is closed. I'm going to hang my bag. Just while I put my cap on here. Okay, and I'm going to choose the port above the Baxter pump so that the pump can regulate my secondary infusion. So 30 seconds, 15 seconds to dry. I'm going to remove the cap and then ensuring sterile technique here. Okay. Now I'm going to back prime my line by lowering it here. Okay, so we have primed the line. And now we're going to set the secondary rate. So we have 104 milliliters in here, and we want to do it over 60 minutes. So it's 104. And volume to be infused would be 104. Okay, confirm. Okay, programming secondary. Press start to begin secondary. Okay, start. Okay, so we've got secondary starting. Okay, and then we're going to watch for 3 drops to ensure that the secondary is running. Just need 1 more. Okay, so we've got 3 drops. And just going to check with the patient. How are you feeling? Is your IV site okay?
Yeah, it's fine.
Okay, now I'm going to document that I've now given the medication. So, and it is 14:30. Okay. And as well, I will be back in an hour once the secondary is done to ensure that the primary rate has begun at the proper rate. And as well, I'll be evaluating how this medication is working for the patient by checking blood levels of white blood cells, and as well just making sure that their symptoms are decreasing. So lung infection, that they have less secretions and that their cough is going away. So that's everything. Thank you for watching.